All right, the South African National AIDS Council at the launch of a national HIV program for sex workers in Johannesburg on Monday announced to many some shocking statistics. It's been reported that 60% of South African sex workers are HIV positive. This survey was conducted by SANAC. The stats release caused a lot of controversy in the country. We're now joined by the CEO of the South African National AIDS Council, Dr. Abdullah. Dr. Abdullah, thank you for joining us. It's good to have you here on the program.
Morning, Leanne.
All right, so you conducted this study, but it was more trying to establish how many sex workers are actually in the country. That was the aim behind it?
That's correct. The study was to establish what are the numbers of sex workers in the country. We have had lots of local studies showing prevalence rates in sex workers, but without knowing how many sex workers there are in the country, we were unable to say how big the problem is.
Yeah. All right, so let's have a look at the figures. I mean, I've been hearing something like 160,000, is that correct?
That's correct. It's a range, but our best estimate is 153,000.
153,000.
That's correct, yeah.
All right, and now coming up to the figure of 60% being HIV positive, how is this reached? How did you determine that?
So the figure that we are firm about is this 150,000, but the prevalence rate among sex workers is from local studies. I'm happy to say that over the next few months there'll be more results released for the big cities. But our general estimates is that whenever sex workers have been tested, the rates are upwards of 60%.
Yeah. I suppose a rather cynical question, but why the sudden concern of sex workers now? Why are they under the spotlight?
You're right, absolutely right to be cynical. We are the country with the largest HIV epidemic, and we've neglected sex workers and their clients for 2 decades. Now that we are on top of antiretroviral treatment, we understand our epidemic better. Within SANAC, we are focusing now on vulnerable populations.
Yeah.
So it's part of a general trend to target high and most at-risk populations, and sex workers are amongst those.
Most definitely some of the most vulnerable, and you find, and from your report I was reading that a lot of them, they want to use protection, but it's the client who refuses. They're paying and they say, no, I don't want to have protected sex. Is that some of the issues that are really causing the spread?
UNAIDS has recently reported that sex workers in South Africa are using condoms, but there are still too many clients who don't want to use a condom.
Yeah.
And sex work is not to be glamorized. It's work that is often in a very difficult circumstances for sex workers. There's a lot of violence, there's a lot of alcohol and substance abuse. They're pimps. So it's a very hard life that they lead. And what we need to do is to do much more to provide them with services and make sure that sex workers protect themselves, but also that clients are educated. Clients who go to a sex worker should be wanting to use a condom. It makes complete sense to use a condom.
Yeah, it certainly does for you and I, but clearly not for some of the people out there that are using prostitutes. But let's look at the issue of legalizing prostitution. We know it's illegal in South Africa. There's a focus on it. We're seeing that there's a major problem. Could a drive like this lead to the legalization of this profession?
Well, something has to change, because for as long as sex work is totally criminalized, we won't be able to reach sex workers, we won't be able to find them, and we won't be able to provide services to them.
Yeah.
So from an HIV point of view, we have to put the reduction of HIV above everything else. Having said that, the Law Reform Commission is looking into this matter. And at our meeting on Monday, the Deputy Minister of Justice explained that the Law Reform Commission was looking at different options. And as soon as their report is released, government will open this up to the public, and then we'll take some proposals to Parliament. Okay.
SANAC, I know you have developed a program that's aimed at fighting HIV/AIDS in the sex workers industry. Talk to us about this. What are some of the details in this program?
So we're very fortunate to have received a large grant from the Global Fund in Geneva of 100 million rand, to provide services to sex workers. And this program started about a year ago. What we do is we recruit sex workers to be peer educators, and these peer educators then reach out to other sex workers with information, education, condoms, and they bring sex workers into a center where then sex workers are taken through what we call a risk reduction workshop. It's like 10 modules on how to deal with all aspects of sex work. And you know, in that context, we are then able also to refer sex workers for healthcare, for contraception, for antiretroviral treatment, but also for social services such as places of safety when they are abused by their partners or their clients. One of the things that we've added now is paralegal support for sex workers.
Yeah.
Because they're often arrests or unlawful arrests, they're difficult experiences with police cells, and now we also building up a system of paralegal support.
Okay, thank you for updating us and talking to us about this, but we certainly will invite you back into studio when the results come out for the different cities, because I know that you're going more into detail about that and the HIV status of these sex workers.
That's correct. We're glad that finally this issue is not being brushed under the carpet. Good. And South Africa's finally talking about it.
Indeed, certainly we are, and with a lot of shock, I think. I think a lot of people were taken aback by this. CEO of the South African National AIDS Council, Dr. Farid Abdullah, talking to us about a report that was released and some findings from that showing that there are 153,000 sex workers in South Africa, 60% of whom are said to be HIV positive. All right, let's take a break.